We are continuing to roll out our response to the coronavirus and to this pandemic, and I want to encourage my colleagues to begin to think how we move past what is this immediate crisis that we are in, and that we begin to look toward what is going to happen in the future with our supply chains and our healthcare delivery systems. And as we talk about the problems that are before us today, let us not forget that 3 months from now, 6 months from now, a year from now, we need to be looking at today and say, here were the lessons learned. And these are the steps that we have taken to make certain that it doesn't happen again. What we have learned, and what many Americans know, is something that some of us started working on a couple of years back. And it was looking at the fact that Americans and American drug manufacturers rely heavily on Chinese companies to produce active pharmaceutical ingredients, or APIs, as they are called. We also know that bad actors in China are poised to use that vulnerability as leverage and to use it as a way to disrupt and interrupt the supply chain of those active pharmaceutical ingredients coming into our country. This is an issue that we cannot wait to address, Mr. President. This is something we need to do right now. And it is why my colleague from New Jersey, Senator Menendez, and I introduced the Securing America's Medicine Cabinet, or the SAMC Act, as a way to encourage and increase American manufacturing of these active pharmaceutical ingredients. Now, here's what it would do. It would expand upon the emerging technology program that is housed within the FDA to prioritize issues related to national security and critical drug shortages, and bring that pharmaceutical manufacturing out of China and back into the United States. Not in 5 years or 10 years, but now. It is something that we need to do right now. In addition, the SAMC Act authorizes $100 million to develop centers of excellence for advanced pharmaceutical manufacturing in order to develop these innovations. These centers will be a partnership between institutes of learning and the private sector. And certainly we've talked a lot about public-private partnerships and the necessity of that to move us through this crisis. And we have cheered as the President has brought private sector companies into the White House to work with him on addressing these issues. One thing we have to realize, and why this is important that we do it now, the number of API manufacturing facilities in China, it is still growing. They have found a vulnerability in our system. They are continuing to exploit that vulnerability. And although we don't yet know how dependent, down to the precise percentage, that we are on these Chinese APIs, we do know that the more Chinese products flow into the U.S., the more potential there is for trouble, and the more vulnerable we have our supply chain. The bottom line is that if we continue to rely on the Chinese to stay healthy, we're doing that at our own peril. So I'm asking my colleagues to join Senator Menendez and I and to support this legislation as a part of these coronavirus response efforts that we are making. The spread of the Chinese coronavirus has put considerable strains on our healthcare delivery system. Primary care physicians are overbooked, and potential patients are afraid of going to clinics at all for fear of putting an elderly or a vulnerable person at risk. I'm in daily contact with physicians' offices, nurses' practices. I am hearing from those that care for elderly, that are caregivers for those with complex medical conditions, and this is a primary concern. For that reason, conversations here on Capitol Hill have turned toward boosting telehealth services to free up in-person appointments for those who need them the most. And I am so grateful that the Vice President and the Coronavirus Task Force has made this a priority. We appreciate that. Coverage of these efforts has made telemedicine feel to many like a new concept, but thank goodness we started building the foundation to support healthcare technology years before COVID-19 spread beyond China's borders. Mr. President, as just a little bit of history, back in 2015, when I was over in the House, I introduced the Software Act to eliminate red tape that was preventing innovation in healthcare delivery. The bill ended up being rolled into a piece of legislation called 21st Century Cures that we passed through the House in late 2015, and then in 2016 it cleared the Senate. What the Software Act did was to direct the FDA to come up with a more efficient way of approving healthcare software so that it would not discourage innovation. At that point, that is what we were beginning to see. The red tape just would pile on to new concepts in delivery, and by the time it got approved, a new generation of technology was beginning to emerge. So software's provisions made it possible for regulators and the private sector to bring us a lot of new innovations. We've got Teledoc, we've got Noom, we've got Fitbit, and hundreds of other healthcare applications that we carry on our mobile device. We've also seen many hospitals conduct post-operation care to patients once they go home. They're entering their data on a specific iPad specific to their surgery, and those physicians are monitoring their care and recovery. This push for responsible tech policy has gone hand in hand with efforts to bring broadband to rural and unserved areas. Last year, I introduced the Internet Exchange Act, which will enable these communities to support the high-speed internet connections telehealth software requires. Now, we all know that you cannot have access to 21st century healthcare or emergency response without access to high-speed internet. These concepts go hand in hand. And at a time when we are facing a global pandemic and the impact that that has on our country and our citizens, we know everyone needs that access and should be able to go in and access this care. Last year, as a part of a rural health agenda that my team and I developed, working with our state and local electeds, I introduced the Telehealth Across State Lines Act so that we could bring health care to the patient rather than always taking the patient to the health care. And I am so appreciative that Administrator Verma at CMS is paying close attention to this and is working carefully to relax some of the rules. Now, what telehealth across state lines would do, it would lead to the creation of uniform national best practices for the provision of telemedicine across state lines. Second, it would set up a grant program to expand existing telehealth programs and incentivize the adoption of telehealth by Medicare and Medicaid. Two things that are needed. We have seen where you have these gaps in access to care. This is one way that we can make certain everyone during these times of a pandemic have access to care. Now, anyone who has ever video conferenced into a meeting, and I will tell you, Mr. President, my staff has been doing that with employers and with organizations and with citizens around our state, and you know this is a game changer during a time when people are not able to come in for a meeting. But my support for telemedicine has been grounded in more than just convenience. The forethought behind this push for telemedicine was to say, how do we make it more accessible? How do we make certain that the care you're able to receive does not depend on the zip code where you live? And right now, as we are talking about testing and communicating with the doctor and being curious as to if we have symptoms and how to treat systems, accessibility is so important. And what we have learned from the dangers posed by the Wuhan, China coronavirus fears that are there and the spreading of this virus, it has made us realize that actually telemedicine and access to telemedicine makes accessing health care safer in so many instances for the elderly, for those that are homebound, for those with complex medical situations. My colleagues will recall that during the first meeting that our conference had with the administration regarding the coronavirus response, I specifically asked officials with the Centers for Medicare and Medicaid Services to push for temporary relief of Section 1135 regulations. That would prevent patients from taking advantage of telehealth services. And aren't we grateful that that has been lifted? And we thank President Trump for greenlighting that. That is what you call a win for consumers that have a difficult time getting to the physician's office. And I will tell you, it's time for Medicaid and for private health insurers to get on board and to cover these telehealth services. For our private insurers, make it easier for those who are covered in your insurance plans to get to the care they need in a timely manner. For our state Medicaid officials, this will involve rethinking some of their licensure and other procedures. For insurance company, it will involve making complex but responsible business decisions. Let's remember, we are all in this fight against the coronavirus together. We are in this fight together. It is up to us to find solutions as to how Americans are going to be able to access the care they need when they need it. So we need to address these things immediately, because this is no longer just talking about convenience or being able to call into a meeting. The coronavirus has evolved into a global threat. Technology that can spare people from the risk of exposure should not be seen as a luxury or only available to a few. We have the tools we need to suppress transmission of COVID-19 in the United States. We have a plan to secure our pharmaceutical and our healthcare supply chains. It is time to get it done. We are the United States of America. We can come together, we can respond to this attack by this virus, we can defeat it, and we can make certain that there is a way to provide access to health care for all Americans, regardless of the zip code in which they live.